Next we'll assess cranial nerves 3, 4, and 6. So I'll have you look straight ahead and I want you to follow my finger just by moving your eyes, not your head, okay? Okay, good. Now we'll test cranial nerve 2 to check for visual acuity. I have a eye chart here and we've measured about 6 feet from Mr. Williams. All right, so I want you to cover one of your eyes and can you just read from the top for me?
LTFPH. LTFPH.
Okay, that's good. Thank you for doing that for me. We may need an ophthalmology referral, but he's done a great job. Next, I want to just check his skin turgor. So I'm just going to pinch your arm here. All right, and the skin returns to its normal state in less than 1 second. So great skin turgor. Next, let's go ahead and assess your heart. So I'm going to listen to the heart with the bell and the diaphragm. So I'm going to go ahead and start with the aortic at the right second intercostal space. Pulmonic, the left second intercostal space. Herb's point, right at the left third intercostal space. Tricuspid, left fourth intercostal space. And the mitral at the left fifth intercostal space at the midclavicular line. And I'll go ahead and do the same again with the bell of the stethoscope as well. Aortic, pulmonic, Herb's, tricuspid, mitral. Very good. Next, I'll listen to your lungs. So I just want you to take some deep breaths for me while I listen to your lungs. Okay. Now, I'm going to place my hands on your chest while you say 99, and I'm just feeling for the vibrations in your chest while you speak.
99, 99, 99, 99, 99.
Okay. Next, I need you to turn around, and I'm going to listen to your lungs posteriorly. So I'm going to just turn the chair, and I want you to have your back to the camera for me. Okay. I want you to say 99 again while I flip your back. Next, I want to check for any tenderness in your kidneys. So I'm going to just palpate the kidneys. You let me know if there's any tenderness.
Yeah.
Tenderness, okay. And now listen to the lungs posteriorly. Some deep breaths for me. So your lungs sound nice and clear. Next, I need to percuss the lungs as well. So I'm just going to percuss your lungs. Go ahead and turn around and face forward again. We're going to go ahead and do some range of motion exercises next. So first thing I'd like you to do is go ahead and lift both hands up over your head to test for flexion. Great. Now I'd like you to put both your hands down. Now let's test for extension by putting your arms reaching back. Okay. Next, I'd like you to put your arms outward, testing for abduction. Good. And now can you cross your arms across your body for adduction? Good. Now let's check the range of motion of your elbows. So I'd like you to extend your arms outward like this and point them upward. Okay, good. Now put your hands out like this. Point your fingers up to the sky and down to the floor. Good. Now can you also do your hands out and in? Good job. Let's check for your strength and your muscles. So will you just put your arms out at your sides again, pointing out like that? Good. I'm going to push down your arms. Okay. Now put your arms out in front of you like this. I'm going to push your arms. And I'm going to pull your arms. Good. I like to do the same with your legs. Can you just put your legs out straight forward? Alright. Point your toes up. And point your toes down. Okay. Now I'm going to put your legs down. I'm going to push against them. Resist my hands. Good. Same with your feet. Alright. Okay, so now that we have performed range of motion sitting, let's go ahead and have you stand up and we'll do a few more exercises. I'm just going to move the chair. Alright, so next let's go ahead and have you flex your hips. So I'll have you lift each knee up like you're going to do march. Alright, other one. Good. I'll have you extend your legs. So to do that, just go backwards like you're kicking backwards. Alright, other one. Great. And can you abduct your leg outward, each leg out like that? Alright. And can you cross your legs in front like this, one at a time? Very good. Now let's check your spine. So I'm going to have you lean backwards. Test for flexion of your spine. Go back. Good job. Now we'll go side to side. Movement side to side. And then let's do some rotations. Okay, let's do some rotations. Alright, another test I want to do to check your range of motion of your arms. Let's have one arm go behind your back like you're trying to scratch your back and reach the opposite arm up over like that. Very good. That's the aptly scratch test. That's a good test of the shoulder range of motion. Now can you do the opposite? Opposite. Very good. Any discomfort with that? Alright. So good job. Now one more thing I want to do to check your spine is I want you to have you face the window there. And I'd like you to bend over. There we go. The spine is looking nice and straight. Now stand up for me and just continue facing that way. Okay, and I just want to check too, the shoulders are even and so are the hips and the gluteal folds. Good job. So I'm going to move the chair back and let's check your reflexes. So you can have a seat. Okay. Before I check your reflexes, I do want to check the Mears test to check for shoulder impingement. So what I'll have you do is I'm going to hold your shoulder like this and put your arm out in front of you. Now rotate your thumb down and move your arm upward and back down. Ooh, I felt a little pop there. Did that hurt? Okay. And let's do the same thing on this arm. And put it out and then rotate your arm in and then go up and back down. That felt smooth. Any pain there? Very good. Let's check your reflexes now. Alright, so we're going to do the brachial reflexes. Okay. Now, let's lift your arm up this way and let your arm hang like this. This is the triceps. And we'll do the same thing on this side. Oops, sorry. Now we're going to do the patellar. So sound like that. Okay, thank you. Very good. Okay, so we tested your reflexes. We've done some range of motion. Next thing we need to do is go ahead and assess the abdomen. So I'll go ahead and have have you, actually before I have you lay down, I do want you to stand back up. I'm gonna just do a Romberg test here before you lay down. So just stand right here with me, face forward. And I want you to put your feet together and your arms at your side. Close your eyes. Good, nice and steady, very good. Next, we did Romberg. Let's check your gait. So I want you to start on this end near the window here, and I want you to just walk across like you normally would. Very good. And when you go the other way, let's do a heel to toe walk. Perfect, great job. All right, so now that we've completed that, let's go ahead and have you lie down, and we're gonna go ahead and begin doing an assessment of abdomen. Yeah, you can take off your shirt if you're comfortable. Okay, now first I wanna also just look at the jugular vein while you're in a lying position, and I'm gonna take my light here. Yeah, perfect, thank you. So I do see the jugular vein here on the side of his neck. It does not appear distended. It does look normal. I do see a light pulsation of the jugular vein as well. I'm just gonna move the camera closer so you all can see. Okay. So next thing I need to do is go ahead and check the point of maximal impulse on his chest. And looking at his chest, and if I look very closely, I can see the beating of his heart there on his chest. And I'll go ahead and feel it as well. And it's palpable. So next, I will go ahead and inspect the abdomen. Right now, the skin does appear to be healthy. I do see a couple of areas of hypopigmented skin here and here. So next I'm gonna go ahead and listen to the abdomen. Also, I don't see any masses in the abdomen either. So go ahead and also take your abdomen next. Starting in the right lower quadrant. Bowel sounds are normoactive in all 4 quadrants. Next, I will percuss the abdomen next. So I'm just going to place my hand on your abdomen and percuss it. And I will palpate the abdomen as well. So I'm going to start with light palpation, and let me know if anything feels tender or painful. And I'm just doing lightly with one hand for light palpation. Okay, and next I will perform a deeper palpation to feel for any masses. And I don't feel any masses in the abdomen. Now I'd like to palpate for the liver, the spleen, and the kidneys. So starting with the liver, I'm going to place one arm right here like this. You can relax a bit for me. And I want you to just take a deep breath in and out. And I'm just seeing if I can feel the liver border. The liver does not feel enlarged, and I'm not able to palpate the border of his liver. Let's go ahead and do the spleen. So again, another big deep breath. And the spleen is also not palpable. That's wonderful, so it's not enlarged. I'm gonna try to palpate for the kidneys next. So again, right about here, another big deep breath, in and out. Okay, and let's do the same over here. Okay, the kidneys don't feel enlarged either. Now I would like to go ahead and assess the span of the liver by using percussion as well. So I'll go ahead and start near his belly button with percussion. And I'm gonna percuss until I hear dullness. So it sounds like it begins to be dull right about here. And then I'm gonna find the upper border of the liver. And there you could hear the dullness there. So here's the upper border of the liver. All right. So we've completed that. I want to just assess range of motion while you're lying down as well. So I'd like you to just go ahead and lift each leg. Bend your knee. Very good. And other leg. Perfect. Now I want you to lift your leg again, and this time I'm going to just rotate it a bit for you. Any pain with that? Very good. Let's do the same thing here. Okay, good job. Okay, I think that completes our exam today. Thank you so much for your time. You can go ahead and sit up if you like. Thank you for watching this assessment, and thank you for my patient, Mr. Williams, for participating today. Thank you.